started. Okay, good afternoon, everyone, and thank you so much for joining us for Employer Insights with Mental Health at the Chicago Department of Public Health. This series is designed to look at different trends that are happening in different industries, talk to professionals, and learn more about career paths. So we're going to learn more about what it's like to work at the Chicago Department of Public Health and how things have changed since the start of COVID-19. Our panelists have been very busy and we're super appreciative that they're here today. So thank you very much. We are recording the session and we'll be sharing the recording with everyone who's registered. And we will have time for a Q&A. If you have questions before then or during the Q&A, you can post them in the chat. You can also send them to myself or Betsy or Kyra, and we will ask them anonymously on your behalf when we get there. Now I'm going to turn it over to my colleague Betsy to talk just a little bit about the many programs and services we offer here at the Career Center.
Thanks, Debbie. Hi, everyone. Good afternoon. My name is Betsy Cahill, and I'm the Career Community Advisor for Healthcare and Science here at the DePaul Career Center. As Debbie mentioned, I'm just going to share some information about the Career Center and our services and resources. So I'm going to go ahead and share my screen. This is the DePaul Career Center's website. So I wanted to start off by talking about some of our advising services and how you can connect with members of our team. So first, we have a chat here on our website. So this is a great resource if you have questions during our normal business hours, how to find resources. Maybe you have an interview coming up and you're looking for some interview tips. This is a great way to connect with a member of our team in real time. We also have a service where you can asynchronously get your resume or LinkedIn profile reviewed. So if you have a draft of your resume, a LinkedIn profile put together, and you're just looking for an extra set of eyes and some feedback, you can submit your information through this form on our website, and a member of our team will review your documents, get back to you within a couple of days with some feedback, and that feedback comes in the format of a video. And then you can also connect with us through one-on-one career advising appointments. So this is a great way to get specific tailored advice and insight to you, depending on where you are in your career development process. This is a great way to connect with a member of our advising team, and I'll show you how you can schedule those appointments through Handshake in just a moment. A couple of other things that I wanted to highlight here while we're on the Career Center's website. The first is our Alumni Sharing Knowledge, or ASK network for short. This is a DePaul specific platform designed to connect members of the DePaul community, current students and alums around career related conversations. So this is a great resource to learn about different career paths and start building your network. Our online career library is a wonderful library of over 50 videos, handouts, and tip sheets about all sorts of career-related topics. I'll scroll down so you can see some of them here: resumes and cover letters, interviewing, job and internship searches, networking, personal branding, skill building, graduate school, and more. So this is a great way to get started with some of these topics, and this is wonderful because it is here and available 24/7. Also, while we're here on the Career Center's website, wanted to highlight our UIP career courses. We have two different types of career courses. The first are our 2-credit career management courses. I know course registration for spring is going to be happening very soon. So as you're thinking about your spring course load, take a look at these UIP courses. They're a great way to go deeper into career-related topics like building your career toolkit, job and internship search strategies, exploring different careers and majors, and more. And then we also have our work and learn courses. So these are just one of the avenues through which you can fulfill your experiential learning credit, for example, while working in a job or internship. So this is a great resource where you can come to learn more about those options. I wanted to now come over to the Handshake platform. So you can access Handshake from the Career Center's website and log in with your Campus Connect credentials. Handshake is our go-to platform for a couple of things. So this is one of the ways that you can schedule an advising appointment with the Career Center. So you come into the Career Center section, and then from here, you can click into appointments and then schedule a new appointment. If you have questions about the system, or if it's just easier for you, you can also call the Career Center, and our team during business hours can also help you schedule an appointment via phone. Handshake also has a whole job board. So this is a great place to come if you're looking for jobs, full-time, part-time. If you're looking for internships, you can search for opportunities here using keywords and a number of different filters. And then Handshake is also how you can find all of our career-related events. And these are events like today's that are hosted by the Career Center, as well as events that are hosted by external employers and partners. Wanted to highlight just a couple of upcoming events that I thought might be of particular interest to this group. This is an event that is being hosted by the Career Center tomorrow, February 9th, how to become a therapist. So if you're interested in learning more about the mental health field, some of the different avenues through which you can pursue that if you have a particular interest in therapy, this event will be a great opportunity. And then also our winter career fair is coming up on February 23rd. This is going to be held virtually through Handshake. We have over 90 employers who will be in attendance. So this is also a great way to get connected with job and internship opportunities and learn about different career paths. And then I wanted to conclude by sharing our healthcare and science LinkedIn group. LinkedIn is a large professional networking platform, and we have a group on here specifically for students, alums, staff, faculty who are interested in healthcare and science. This is a place where we really frequently post job and internship opportunities, information about upcoming events, and so forth. So this is a great way to learn about things that are going on at DePaul that might be of interest to you as well. So I'm going to go ahead and pause there and turn things back over to Debbie to kick off our event.
All right, thank you so much, Betsy. There were some questions about one of the links that I posted in the chat. Hopefully this new link works. If not, we can revisit that a little bit later. So first, I would like to have our panel introduce themselves. If you could share your name, your pronouns, your position and department at the Chicago Department of Health, and how long you've worked there, and anything else in your introduction that you would like to share. So Tiffany, we'll start with you.
Good afternoon. I am Tiffany Patton Burnside. I am an LCSW. My pronouns are she and her. And I am the Senior Director of Crisis Services with the Chicago Department of Public Health in the Mental Health Division. And I've been with the department since August of 2021. Yes, this is 22, still 22. Yeah. So I just started recently with the department. I don't think I've been there. It's been just like 6 months. So I consider myself still new.
Thank you. And Kathy?
Hi, everyone. Good afternoon. My name is Kathy Calderon. She, her pronouns. I'm the Director of Mental Health Operations with the Chicago Department of Public Health. I work alongside Tiffany in the Office of Mental Health and the Behavioral Health Bureau. And I also just wanted to add that I'm an LCPC. So I'm a counselor, and I worked in community mental health for many years before transitioning to this role. And I started in October of 2020. So I'm also relatively new.
Thank you. And Lorena?
Hi, Lorena Oviedo. My pronouns are she and her. I'm a clinical therapist 3 at our Greater Lawn Mental Health Center here. I'm also an LCPC. My prior role to here was I spent the last 12 years working in the not-for-profit sector in various positions. But the majority of my mental health experience comes in working with adolescents and families who were dually involved in the child welfare system and the juvenile justice system. So yeah, and I've been here 3 years, but I still consider myself new because I almost feel like ever since COVID, everything is changing and everything's evolving.
Sure. And Lorena is a DePaul alum as well.
Yes.
All right. Well, thank you all. We're so happy to have you all here. My next question is, what does the Chicago Department of Public Health do? And what is the role of a city's public health department? Kathy, we'll start with you.
Great question. So, the Chicago Department of Public Health is very far-reaching in terms of health initiatives and promotion. So I'll just be being transparent. Tiffany and I worked in the field together in the mental health side of things, and so I'm very clinical and used to being therapist and director of programming around mental health, and so I feel that I didn't envision coming into the field of public health. So it's a very exciting field to learn about from, not having sort of my education based in that. But at the Chicago Department of Public Health, there's a range of programming, especially during COVID. There was a lot of resources coming out of the public health department to really respond and activate resources for COVID response. So there's a lot of changes within there, but there are different departments. So we're in the Behavioral Health Bureau, but there are also bureaus across HIV, nutrition, the MICA unit, so maternity, infant, and child health. There's epidemiologists here, there's informatics. So, for lack of being able to rattle everything off, we're really looking at population health and looking at how to really create a more equitable and healthy Chicago. So the CDPH has a larger strategy. And as someone else is talking, I'll put that in the chat so that people can see sort of really working towards decreasing health disparities and helping to decrease the life expectancy gap between Black Americans and white Americans, and just really figuring out how to help increase equitable supports across Chicago's communities. So we are specifically in mental health, and this historically has not had a lot of funding or programming in the past. And so upon Mayor Lightfoot's administration, she released the framework for mental health equity. And so that has provided us with a lot of resources for expansion, not only to invest in our own clinics, but also to fund providers and really engage in systems coordination and activation of the mental health landscape.
Well, thank you. I feel like that's a very comprehensive overview. Lorena, anything to add to that?
I think Kathy did a really great job, because it is really just about prioritizing the residents and the communities that are most in need in regards to not only just mental health, but like safety and just how to access primary care, so just to add that.
Thank you. And Tiffany, anything that you would add?
I think I would just add, in an effort to make things equitable, just ensuring that the citizens of the city can access the health care that they need, regardless of their ability to pay or their residency status. And so just ensuring that anybody can get help. And with the city, most times people don't think, the city as a government entity, it has the ability or the desire to want to help its residents, because that's what the government doesn't really help. But I think the Department of Public Health, the Chicago Department of Public Health, has a special vested interest in its residents, making sure that its residents have health equity across the board.
Thank you. So next, I'm curious if you could all tell us about what you do on a daily or weekly or regular basis in your roles at the Chicago Department of Public Health. So Lorena, we'll start with you this time.
Sure. Okay, great. So my primary role here is I'm a licensed clinician that I provide individual therapy, but that looks like in a variety of ways. So there will be times where I find myself doing parenting skills, family therapy, couples therapy, medication management, social skills development, psychoeducation, and translation services as well. We're in a primary Spanish speaking community, and I'm the only Spanish speaking therapist here. So a lot of my role is to kind of bridge the gap in the services that they're able to access when they're navigating our clinic here. And we have about 5 other clinics. If I'm incorrect, please correct me, Kathy, throughout the city. So
There's 5 in total. Yeah.
thank you.
Thank you. And Tiffany, can you tell us about what you do on a regular basis?
So I am the Senior Director of Crisis Services. Essentially, my team is responsible for an alternate response team. It's a very innovative team. It's a brand new team in the city. Chicago does not have this type of alternate response team in which we respond to mental health crisis in the city. The purpose of this team is to infuse a mental health clinician, a licensed clinician, into the 911 call system. So over the course of the phases of this program, there will be a licensed clinician at 911 call center. The teams that I supervise, those teams consist of a licensed clinician, a community paramedic, and a CIT officer, and we're providing crisis services to residents in a pilot phase. We're in pilot phasing right now to the residents of Lakeview and Uptown, and then Auburn, Gresham, and Chatham areas.
Thank you.
So on a day-to-day basis, I make sure they do their job. Just the supervisor.
Thank you. I'm really excited to hear more and to see your team in action. And Kathy.
Yeah, I just want to give a shout out to Lorena and Tiffany because I think they're really showing the amazing work of the mental health expansion that we've been experiencing. And Lorena has been leading the space in expanding services to youth and adolescents, which is something that, you know, historically, at least in the past couple of years, has not been available. You know, services are available for 18 and up. And so Lorena has been doing awesome, especially, you know, so it's been fun to work with you around that. And then Tiffany, it's a lot of new things and working with different systems. And so I'm excited for both of their work. And so for what I do, I oversee the framework for mental health equity and all that entails. So there are 4 pillars to the mental health equity framework: expanding outpatients, behavioral health services that are trauma-informed, integrative, and available to people regardless of their ability to pay, immigration status or health insurance, increase mental health services for survivors of violence, programming and community-based programming and helping with the continuum of care around serving adults with complex mental health issues, co-occurring disorders, and experiencing, you know, medical issues or homelessness. And then finally, the 4th pillar is systems coordination, which includes rolling out a 211 line that will entail social services. So there'll be a city line that people can call that's not 311 to get resources. We also launched a mental health awareness campaign. And then I would say a lot of the work that Tiffany and I do around systems coordination is not sort of written. We are just doing it to really mobilize providers, to really help people work together on behalf of Chicagoans and really to create sort of a connected network that is healing centered and accessible for people across the continuum of care. For those of you, you know, who are learning about mental health, there are a lot of different services that you can provide, and there are people who need different types of services. And so how do we help people access the care that they need and get the right treatment and the right service types that they need? So on a daily basis, I am talking to people a lot, I guess. And I have a team. One of the big pieces of our job is that we get funding through the budget, the city budget. So there's city dollars, but then we also get federal funding, and we have projects that we need to support with that funding. So there's a lot of city processes behind how do you get an award out? How do you get agencies to propose and then get awards? How do you get people paid? A lot of administrative tasks, but also a lot of big picture thinking and innovation around how do we strategize, looking at really strengthening the mental health safety network of Chicago.
Thank you. That's really cool to hear from all of you. And I know as a Chicagoan, I feel very lucky that we have a department like yours that is really committed to taking care of people across the city. So I'm curious, you have all mentioned a little bit about what you did previously, some work in the field and some of your graduate degrees. I'm curious if you could tell us about what interested you in your position and what interested you about the challenges and the rewards of working at the Chicago Department of Public Health. So Tiffany, we'll start with you.
So I've actually worked in behavioral health in crisis for quite some time. My work started in inpatient psych. Um, I am a firm believer that in order to really cut your teeth in this field, sometime inpatient psych allows you to be able to see true mental illness and see what mental illness is in a very confined space, but it's also that most acute mental illness. So it's not in the community, it's not the day-to-day, it's when things are all the way at their worst. And so being able to help identify, like if you're new in the field and want to see what this looks like, I feel like it's a good space for you to grow and learn. And that's where I started. Well, actually, no, I started because my mom was a psych nurse. And my first internship was working for her at a mental health clinic. And so I was able to like get an understanding of who the people were, not who their illness was, what their illness was, and knowing someone for who they are and not what their diagnosis is really where it began for me. How I ended up at the department, I'm still not quite sure. I responded to an email about this position, and I felt like I was the best fit. So after reading the job description, and knowing the work that I had done in the crisis space on the county side of things with just the grants that the community agency I worked for had, I already knew all the players that were going to be in this space for this new program. And so it just made sense that I apply. Like this is kismet. And so I applied and I got the job. And so I can say nothing but, it was grace. It was God's grace. I didn't know the position was available. It popped up in my email. I still don't know who sent it to me, but it worked out. And I'm thankful that I'm here.
Yeah, we are thankful as well.
It
And
didn't say the person's name on the email.
Oh no, it said the person's name. I just didn't understand how why Alicia emailed me. Because it was in the, when everyone sends out the e-blast, it was in an e-blast, but it didn't come to the normal people that it would have gone to within the agency for the e-blast. It came directly to me. And I was like, am I supposed to send this out? I'm not. I'm applying for this job. This is my job. So I hedged my own bets in that one. No, I didn't share the job posting with anyone else. I wanted the job for me.
That's great. It just shows that it's always important to be open to opportunities and maintain your network. And Lorena, how did you come to the department?
Sure. So the service has always called to me. For me, I've always it was one of the biggest values that was kind of instilled from my parents. After leaving DePaul, actually, and I think it was DePaul that linked me to my first behavioral health position, which was at Association House of Chicago. I started off as a case manager there. And just working with the different mental health issues that people were kind of going through in that area, the developmentally disabled population as well. Just having them on my caseload, just seeing the need. And I just found myself helping them beyond case management. And that's kind of when I sought out for my master's degree. But very much like Tiffany, I feel like the opening for this position kind of randomly came about. I couldn't even kind of pinpoint where it came from, but it was in my community where I live in. So for me, it was really eye-catching because I didn't know that service was available to people and just in general, that it was available throughout the city of Chicago. And I've lived in Chicago since I was 2, so that's 36 years. So for me, it was really just eye-catching to kind of give back to my community. For me, it's been really important since we immigrated here from Mexico. So I know the language gap in helping my parents translate and learn the system. So for me, being able to kind of be that person that kind of still helps in bridging the gap for folks here, especially in the Greater Lawn community, has been really important to me. And it was the one thing that really just continues to keep me in this role, and continues to just kind of help me thrive in that passion of like just helping people in my communities.
Thank you.
Mhm.
And Kathy.
Yeah, so I'm a trained clinician, so I worked at a community mental health agency for about 10 years before kind of engaging in a slew of transitions and during the pandemic. But at that agency, I was a therapist for about 4 years, a supervisor for 4 years, and then I transitioned to a director of outpatient children and adolescent services. So I as a clinician and during my time, I worked with children and families struggling with really complex trauma, but really working around the systems of care that support those families and doing family therapy and sort of addressing intergenerational trauma and then supporting clinicians and their growth in the clinical work. And so there are a lot of challenges and barriers that mental health providers face, especially those who are serving people in, communities of high need and who are on Medicaid or, utilizing public funding or have barriers to treatment. And so I think as I got more into the field, I was doing a lot of systems work, coordinating learning collaboratives, really working with other providers. Tiffany and I worked together, knew each other through the agencies we worked with. And so, the agency I was at was facing financial challenges. And so I kind of jumped to go to a different agency and do a similar role and realized pretty quickly that it just wasn't a good fit, that the work culture was different and my role, even though it seemed similar, was very different. So then I moved to being a therapist at the Chicago Police Department. So I worked there for about 4 months and learned a ton. But then I actually heard about this position through different meetings that I was in and just was really excited about the mental health equity, the framework for mental health equity and just the work around that and, really the essence of what that means. I did not realize how administrative this role was and what a change it would be from the clinical world. But I do think kind of working through that transition and about a year in learning the ropes and then figuring out there is a lot of clinical work that we're doing on a city level in terms of systems coordination. And I think that really I'm grateful to have the team that we have and sort of the subject matter expertise because of the current environment that we're in. There's so much funding and so much need, and it's very, there's a lot of urgency around how do we get care to people and how do we respond post-pandemic to the mental health issues that were existing in broken systems and now exacerbated. And not to sound dire, but I think it's important to have people who can really implement the initiatives and strategies that we need at this time. So that's kind of where my trajectory is. But I'm always like kind of wanting to jump into conversations or doing case consultations or, trying to infuse some of that clinical work into what we do. And I also am working in the intersection of violence, mental health, and substance use. So the city has stood up this Community Safety Coordinating Center, which is an all government approach to addressing violence. So they're polling people from all government departments, many government departments. So I'm there once a week and we're setting up a mental health event around violence and really supporting our providers and giving them a healing centered experience to work through trauma exposure and then also engage in planning around violence response for the summer. So there's a lot of exciting stuff.
Cool. Thank you all.
Can I say one more thing?
Yeah,
I'm sorry. As Lorena was talking, I just wanted to drop a link. It sounds like the three of us kind of got word of these positions, but before I knew about this, I heard it through the grapevine as well, but there is the City of Chicago job board. So I would say just tag it, check it, and there's a ton of vacancies most of the time. So I would say just keep it on there and check it out every once in a while.
Thank you. And we'll include all these links. Thank you for including the Healthy Chicago 2025. And Tiffany, thank you for adding the community resource guide. We will include those also in our follow-up email. I'm curious next if you can talk about some trends or some issues in public health that you've observed in your work. So Lorena, we'll start with you.
So one of the issues that at least specifically with the clinics that I've seen has been kind of like a lot of what the work is we're doing now to address it, which is accessibility for services. So sometimes there's a lot of barriers that prevent people from being able to access it, whether it's knowledge of it, whether it's language barriers, whether it's insurance or not knowing that we take patients without insurance or residency. Like as long as you live in the city of Chicago, you are entitled or have access to these services. So I think that's one of the main issues that I've been able to observe since I started off, especially in the Greater Lawn area. And it's also just the need for Spanish speaking providers. It's just been huge when it comes to like psychiatric nurses or psychiatrists, to be able to just have people be able to feel comfortable to speak in their primary language is just so important, not just Spanish, but like any other language where our clinics can provide these services to folks. So that's the one trend that I feel like we are working towards, trying to make sure that we do have that accessible and that we do expand on the number of languages that we're able to kind of provide services in. So that's one area.
And Kathy, what would you add?
I would agree. I mean, access to services and specifically when it comes to mental health, addressing barriers and disparities. So the lack of mental health services in certain community areas, or how do we create more culturally responsive services that are available? And also, I mean, a lot of work that we're seeing is that there are people who do not fall in those access points. So they need care. People may see them in the community, but the way our systems are set up, the care doesn't get to them. And so really thinking about how do we think creatively around setting up systems of care. But I mean, I guess in terms of mental health, I just feel, again, I know I stressed this, but it's just an urgency right now around getting enough services. There's a workforce shortage of mental health professionals. There's a huge need for mental health services for children and adolescents. So the Surgeon General issued an advisory around the urgency around mental health needs for kids. And Tiffany and I also work in the space of individuals who are really struggling with serious mental illness and are experiencing homelessness, and how they may engage in a lot of law enforcement or frequent hospitalizations or the homeless services sector, and just really figuring out how do we help provide that support and accessibility. And I'm going to also drop the link for the Unspoken campaign, which is the mental health awareness campaign. This is launched, I want to say around August as well.
Thank you. So we're hearing accessibility, urgency, workforce shortages. Tiffany, what else would you add?
I would think within the space of what my work is getting people to understand who is the appropriate responder in the first responder chain, and adding a mental health clinician to the first responder chain is really is a trend. This is happening all across the country, where police departments are hiring on social workers and other clinicians to be able to actually appropriately respond to people who are in a mental health crisis. And it is known that the police, they aren't trained to respond to these individuals. However, there was never a system that was ever in place to say, well, who do you call if there is a crisis? Who do you call if there is a mental health crisis? You call 911. But there's never been a system in this country that says once you call 911, you're going to get a clinician on the phone to help work with you. Typically, people will call like a suicide hotline. They'll call the hotlines for certain types of help, but those hotlines may not be geocoded. You may not actually be able to get to a person to get the help that they need, because that hotline is very limited. Whereas the 911 system, while it does have its limitations, adding more people to it that are professionally and classically trained in this field of work can severely impact in a positive way how mental health crises are responded to in the city. And so that's the trend that I am currently working through, as making sure that mental health clinicians are included as first responders in this particular world. And this world is not, excuse me, this world or this trend isn't going anywhere, as COVID is continuing to rage forth, and people are continuing to manage or not manage social isolation. We'll continue to see this uptick. We'll continue to see people having to actually face those mental health challenges that when you were in a very busy world, you weren't able to sit down and deal with, and now you are. And some of it is very overwhelming and requires more support than you would normally have gotten from just talking to your friends, because you can't go out and see them anymore. So as COVID has impacted this world and made people more socially isolative, it has also put a spotlight on people who are suffering from mental illness, and even heightening that mental illness, because living socially isolated is not necessarily the most healthy for that person.
Thank you. And Kathy, you want to add something?
Yeah, I think I was just reflecting on my answer, and I wanted to also speak to the trends in public health in this current environment. I would say, Tiffany mentioned COVID, and I wasn't here before COVID, but I know that across the department, there's just significant expansion happening, and significant funds being funneled down from federal government across program. And so really thinking about, how do we implement and distribute these funds in an equitable manner? How can we work with very short staffing levels, because our hiring processes are not catching up to the volume that we need to hire? I mentioned vacancies earlier, but I think really working within some difficult city systems to really get this expansion going. And so I think that's definitely a trend in terms of thinking, how do we be innovative? How do we be flexible within the processes that we have, and especially when there's not enough hands on deck. But I think that, everyone works hard. And so it's just a matter of being strategic and really seeing the bigger picture, so that we can figure that out.
Sure. Well, I think that leads perfectly into my next question, which is, what has changed at the department as a result of COVID? I know, Kathy, you mentioned trying to do more with less, but also more funding. What else would you add to that?
Well, I think that the impact specifically on mental health and COVID, so mental health has become more normalized and sort of front and center as COVID, has gone. There's still a lot of stigma, but I think that just the needs that have been exacerbated, people are more likely to talk about mental health, to address mental health. And yeah, in terms of COVID across the department, I think there's a lot of restructuring going on because we had a COVID response unit, but that was sort of absorbed across. And so there's just a lot of trying to figure out, how do you fit all these pieces into the larger scheme of things. And for me, I remember, I don't know, maybe it was the first couple days that the pandemic was hitting. And I don't know if you all can remember that first, when it really hit you that this was happening and that it was huge. I remember thinking about all the families that I worked with where there was abuse happening, and just really being overwhelmed by the impact, the longer term impact, right? And I think that we haven't really had a chance to recuperate. We haven't had a chance to reflect because we're still going through it and sort of in that reactionary response mode. And so I think, again, just being aware of, we're not going back, we're moving forward, and we really have to be intentional and thinking outside of the box in terms of how do we address this. And we can't necessarily rely on the systems that were in place. And so, it's hard work, and Tiffany can speak to that in terms of dealing with, law enforcement and Chicago Fire, and everyone has their own processes in the city departments. It doesn't make it any easier to get things moving. So I think, just really thinking about what we're up against moving forward, and figuring out how to address the impact, and also how we move forward together.
All right, thank you. Tiffany, what would you add?
I think as a city, due to COVID, we had to pivot. Everyone, that was the trending word, pivot, especially when, you still had to take care of the people who are the most vulnerable. of us. And how do you do that when we initially had all of these systems in place and then we were told you can't go into anyone's home, but you have clients who are not going to come out to get their medication. So now you have nurses who have to pivot and figure out how to go get medication and still medicate their clients in their homes because they can't come out. Having to the advent of and widespread use of telehealth in instances where for most of our clients, the severely mentally ill population, they don't use cell phones in the same manner. And so we have to pivot again. And how do you train someone on how to use a smartphone and be in their space to do so when we're told we can't go into anyone's space? You have to stay your 6 feet apart. And so this notion of pivoting in an effort to take care of the vulnerable populations, I think in this space, this is where the Department of Public Health has offered guidance in how to get this work done and how to be creative about getting this work done and how to be flexible about getting this work done and keeping us as first responders, as essential workers, informed of current practices as well as current numbers and rates and how to protect ourselves, and being quick in allowing us to be able to care for ourselves in this time as well. Not letting it go unknown that as an essential worker and a first responder, self-care is vitally crucial, and allowing for us to be able to take that, to be able to do that and say, you know what, I got to have some time. I got to put my own mask back on. I can't continue to help someone else until I secure my mask. And so I feel like, and this is just in my time here, and maybe it's because I have a great team, but that is something that has been very upfront for me, even in having weekly report outs by Dr. Arwoody, and just so we know what's going on as a division, as a department, just so we can have some understanding of what's happening and being very transparent within our own ranks, so that we know what we're doing and we know how to move forward.
Thank you. And Lorena, what would you add?
No, I would definitely highlight what Tiffany was saying. Like the word that just kept popping up for me was the pivoting, like just kind of learning how to pivot in various scenarios, because early on, as COVID was happening and we were realizing, like Kathy said, like, oh, this is really happening. Like the trainings that they were talking about months before, like this is like the rollout of like, okay, we're moving on to the front line of like trying to set up a system within our public health department to have all the departments really give a different role based on whatever need we had in the communities that needed to be reached out to. I was part of some of the team that were reaching out to initial people who were contracting the virus and getting food out to them, making sure they're okay, making sure they're getting letters for employers so that they are excused to be home. So a lot of that is a lot of buildup that we're also going through, in addition to helping our residents that live in our city going through. And like Kathy mentioned, just kind of her saying that there's no going back. So there's really no debrief of like just kind of how we've rolled with it, and just highlighting like the importance of the self-care and just taking care of yourself so that we are able to continue to move forward. We don't want to take any steps back, and just kind of acknowledging we're all working through this together. But the major shift that I've seen is just the expansion of services that now we do by phone, we do by video chatting. We know where we can flex now, and where employers willing to give us that flexibility so that people are able to be reached and are able to be serviced.
Thank you all. Just being cognizant of time, we're gonna open up to question and answer. So if you have a question for our panelists, you can type it in the chat, you can unmute yourself, or if you would like myself or Betsy or Kyra to ask the question for you, you can send it to us as a direct message in the chat. So welcome your questions.
I have a question. I don't know if this is, if anyone would know. I'm a second year master's student in counseling, and I'm currently trying to apply for internships. I was wondering if if there was a contact person that I can contact regarding internships for second year master's students. Yeah.
Wants to go. Tiffany, should I go, or Deb, do you want to start, like from the DePaul perspective, or should I go?
Yeah, I have no idea. I'm the newest one here, so I don't know how to access how one would go about getting an internship with the city. I feel like if you went to the website that Kathy dropped in the chat, the city career section, the Chicago career section, maybe that's a starting point.
Let me look. So I'm sorry, this question was specifically about city internships, correct?
Yes.
Counseling for second level masters, yeah.
Correct.
Sophia, I know that I've been in talks with, at least like we've been told like there's a possibility, but I don't really know. I know that for sure we've been asked, like, would we be willing to take on interns? Yes. But I think it's just a matter of the development of those services, and the site that Kathy did post on there where it says apply for, it does have internships and volunteer programs that are in place. But what I can do, I mean, I'd be willing to kind of have a conversation and kind of see if there's a fruition for counseling master's levels that is happening or in the works. So we can provide Debbie with an update on that and give you a definitive answer versus right now, we don't have enough information.
Yeah, I mean, I would add, Lorena, thank you. That's true. I think we are hoping to develop a clinical and a non-clinical track around, well, not necessarily non-clinical, I wouldn't say that, but more of like on the administrative side of things. Because I know our Office of Violence Prevention has interns, and so we've just been working on developing that program. And I know there is, like Lorena said, there's interest, and there are people, all of our clinicians are licensed, so they're able to supervise. So we're hoping to build that out. But I think is your timeline that you'll be applying this spring?
I'm applying right now for the 2022-2023 year.
Mm-hmm. Okay. I don't know, that might be something that we can talk about, Tiffany and Lorena, with Alicia.
Thank
Yeah.
you.
And then Anna had in the chat, what type of summer jobs or internships did you have in college or right out of college? My internship, I did my first year internship at a group home, because my initial track in my master's program was children and families. My plan was to work for DCFS and or open a group home. That was what I wanted to do as a master's level clinician or master's student. And so in my second year of field placement was at a high school, because I thought high school counselor would be a good role to go through. Again, children and families was the track that I was on at that time, and it just made sense. So, and then as far as summer jobs, anything that paid, I was it didn't matter as far that how it lined up professionally wasn't as important to me as maintaining my finances. And I think during my master's program, I had just gotten married. I had a 3-4. My son was like 4. He was starting preschool. So, and I was working inpatient psych at River Edge at the time. So I was a full-time employee at the hospital. It wasn't a summer job. I was living. I had to live life and go to school at the same time. And that's not always everybody's story, but that was mine. I was an adult student.
Thank you. A lot of our students are have similar experiences where they're also working full-time while studying, either for undergraduate or graduate school. Yeah. Lorena?
Yeah, sure. So for me, like right after DePaul, like I had mentioned before, I started working in nonprofit sector, which Association House was my first job as a case manager leaving college with my bachelor's in psychology. And while I worked there, I just saw like how much I really enjoyed working in the behavioral health field. Um, and I started collaborating with therapists, and then I learned about their role and what needed to be done in order to be able to be in their role. So that's when I started to seek out for my master's after that. And after that, it was really just a lot of case management and kind of like Tiffany said, what is going to pay to get you through school, making sure that you're able to have a living. And for me, it was just case management. And then I worked as a career coach as well for the homeless population with San Jose Obrero Mission, Casa Central. Like I worked through a lot of non-for-profits, One Hope United. And that's where I always guide people to go to is search the non-for-profits around you. They are most willing to mold and educate and expose. They just have the ability to be able to do so, and just kind of like what Kathy was saying, we make these partnerships with these agencies so that they can do startups and do start new roles and new programmings that are able to kind of like fund positions like those. So that's what was for me, at least.
Thank you. I'm going to add a link in the chat here to the Winter Career Fair. I know Betsy mentioned that at the beginning. We have a couple of community organizations, mental health organizations coming, and nonprofits as well, coming to join us at the fair. So I think that would also be a great opportunity to learn more about roles that are open if you're looking now, or if it's something that you're looking for in a year or two. Thank you, Carly, for joining us. Other questions?
This relates a bit to Anna's question, but I was just curious about any advice that our panelists might have for students who are interested in pursuing careers in public health and/or mental health.
Yeah. Yes, Lorena, please.
Sure. What I want to definitely share is like, don't hesitate to ask questions, like interview people for the positions and careers that you're interested in. I've gotten random emails from students just knowing in what role I play, and they ask me questions, and that's just so important to do. And I feel like it really just gives you the opportunity to ask the questions that you might be afraid to ask during an interview. But knowing someone in the role or who are doing it that can give you any tips or just tricks on like how to navigate a certain system or just interviewing style in the moment, it would be super helpful. Just don't be scared to ask those questions. Ask them. Worst case scenario is you don't get an answer, and that's it.
Thank you. I think that's great advice. And Tiffany?
I would have to say what I always tell interns is that this work is a labor of love and not a labor of money. So if you think you're going to come into this field and make tons and tons of money and get rich, you were going to get rich in human capital and human equity, and that's it. Because it's truly, we do this work because this is the work of our heart. This is the work that we were actually called to do. It's not something that, it's not glorious. It's not glamorous. Like, I would love to say I'm the next Jane Addams. I'm not. I'm just Tiffany. That's it. And I am passionate about making sure that this vulnerable population that we serve is treated the way they should be treated and get the help that they need in every avenue. I say over my course of time in this field, I have, gotten my hands dirty. I've worked with children. I've worked with adolescents. I've worked in specialized foster care. I've worked with adults with severe mental illness, inpatient hospital, community. I know what I'm supposed to be doing. I know what I'm not supposed to be doing. And the things that I just know that aren't for me as far as in this field, because there is a lot that you can do in this field. If you know you don't have a heart for it, then that's not the thing for you. So for me, while Kathy can say, and Lorena can say therapy was their thing, that's never been my thing. I never got in this field to do therapy. I got in this field to like literally handhold and get people from their point of crisis or their dark space to their hope and get them there in the community setting as opposed to in an office setting. And so I'm the one who will go out and do all the running for someone, making sure that the foster parents had what they needed, or the children had what they needed, and understanding that the work that we do truly comes from our hearts. And so for me, my path has always been, and I've always wanted to do policy work. And so, but for me to inform policy, I needed to practice. For me to inform practice, I need to practice. And so working with this population and knowing now on a very intimate level what the needs are, and still not being afraid to go out and still do this work, because if somebody on my team doesn't show up, I'm going out and I'm going to be doing this work too. And knowing that I'm not too big in the seat that I sit in, I'm never too big to go out and still work and make sure that the individuals that we serve are getting what they deserve. And what I'm saying we're actually doing. Because there's nothing like lip service and not delivering on a promise that you say you're doing, the work that you say you're doing. And so that's my big thing. That's my, I guess, advice for the field. Do what you say you're going to do. Stand true to your word, and just understand that your mission is to take care of people who can't take care of themselves.
Thank you. And Kathy?
I'm muted, sorry. I know there's a minute left, but I just wanted to speak to kind of public health and mental health. I think there's intersection on both sides. If you go into, I think it's helpful to think about like what is your point of intervention if you want to look at populations on a macro level, or if you're curious, if you would like to work on that more individual level on the ground, providing those direct mental health services. I think there's room for both. And so I would explore different programming, especially programming that has mental health. And there's a lot of public health degrees that infuse mental health. And so I would say just definitely explore, and we're here as resources as well if you have more questions to think about how that looks. I don't know, I can't see a different route for myself to get to where I am. I feel like my work is informed where I'm at now. I don't know, it would have been difficult getting public health training and being in this role from what I'm thinking, just because I use my clinical work in the families that I served and the ways that I experience the systems and trying to provide care, and really informing how do we address that now.
Thank you. Well, since we're just about at time, I just wanted to thank our panelists. Thank you so much, Lorena and Tiffany and Kathy, for sharing your insights, for sharing your work, for sharing your passion and your care with us, and for sharing your advice. Thank you for the work that you are doing to make our city more equitable, more healthy, and better for all residents. And thank you again for sharing your time and experiences with us. We'll be sending out the video as well as all the different resources and links that our panelists shared today. Don't be a stranger. We hope to see you at another Career Center event soon, and have a great rest of the day.
Thanks everyone, good luck.
Thanks.